Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban. I'm super excited about today's episode. Today is episode 2 of a 4-part episode regarding diastasis recti. And we have some amazing guests. You're definitely going to want to tune in and hear more about this very challenging condition and what we can do about it. All right, welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban. I'm super excited. We have episode 2 of our 4-part series on diastasis recti. I have 2 amazing guests here with me today, Rihanna and Heather, coming to us via Zoom, the new norm due to Corona. Everyone who knows me knows I hate this crap. I wish that we were all in one room. We have 2 beautiful women. Sitting here via Zoom does not do them justice, but we will manage. We're going to have this second episode. We had an episode before where we touched on the psychologic as well as the physical impact of DR. At every beginning of every section, I will define diastasis recti for those who are tuning in. Diastasis recti is a fancy term for muscle separation that occurs as a result of pregnancy and muscle intra-abdominal stretch. So an individual, predominantly in the case of a woman who has her 6-pack, in reality 8-pack, that gets pulled further apart with every pregnancy. When you have pressure inside your abdomen, the abdominal wall gets pulled and pulled and pulled, and with every pregnancy slightly more, and in some instances leaving you with a severe dysfunction of your abdomen. That's called diastasis. So today's episode is called From Pain to Freedom, and we're going to talk about so-called curing diastasis. So let's start with Rihanna. So tell me who you are and where you are and what you do.
I'm in Winnipeg, Canada. I'm a mother of 2 girls. I teach fitness as well. I do makeup for a living too. And I discovered I had diastasis after my 2nd child.
Okay, great. And then you put together a group, right?
Yeah, I did. So after going through everything that I went through, which was a lot with my DR, I put together a group to help women that are planning surgeries or trying to decide if surgery is right for them or not, and women that have had surgery so they have a support system in place and other women that can relate to what they're going through.
And that group is called what?
It's called Diastasis Surgery Support Group. It's a private Facebook group to protect. I made it private to protect the members' privacy. So someone who wants to join has to friend request me or one of the other admins, and then we check out their page, make sure they're legit, and then we add them into the group.
Okay, that's awesome. And so basically what people, it just goes to show you, we create advocacy groups for people that need advocates, right? Yeah. And so we were just chatting offline a little bit that, right now we're in a country where we're dealing with racism and all those very challenging concepts. And so there's groups going out there saying BLM, Black Lives Matter. That's their championing cause. And so we're getting together to talk about diastasis because that needs a voice and it needs people to educate because it is complex, it is impactful in people's lives, and it can be lonely. And so good for you for creating an environment where we can get not just information, because information is useless unless it is curated and correct and accurate and carefully discussed. So that's awesome. And then we have Heather. Where are you, Heather?
I'm in Northern Colorado.
Ooh, Colorado. That always sounds so, I just want to disappear into Colorado.
I kind of
or
did.
Montana. And what do you do, Heather?
I'm a physical therapist. I've been working for 26 years. And I actually recently came to Colorado. I met Renee and worked in Dallas, Texas for several years too.
Okay, awesome. So we have 2 really unique guests today. We have 2 people that are in physical fitness. One is a physical therapist. One is could I refer to you as a trainer? I never know what.
I'm not I am a bar instructor. So
bar, okay. Because nowadays, shit, if you say the wrong thing, you're gonna get crucified. No, that's okay. Like 1,000 comments. He said personal trainer. I'm so offended. And then also we have people. You had diastasis. You had it corrected in Canada. I did not do your DR correction, but it doesn't matter. So what we want to talk about is this idea of. Let's just dive into kind of a hot topic, which is the idea that here I am, I'm a mom, I'm in Ohio. I gave birth to two beautiful children. I'm 5'5". I weigh 125 pounds at least before pregnancy. And my children, I gave birth at 39 weeks, and my child was 10 pounds, 22 inches, both of them. And now I'm like looking at my abdomen. I've done my part. I've done diet. I've done exercise. I go to the local gym. I've done everything I'm supposed to do. And I still look in the mirror. I don't know, look like I'm 3 months pregnant. Every time I sneeze, I have to make sure I don't go to the bathroom. My back is killing me by the end of the day just to go to the grocery store. And I'm wearing like pregnancy clothes. So that is a classic scenario of an individual who is suffering from this DR, this severe DR. So then the question is, what do I do about it? And so there's a whole world of non-surgical treatment for DR. What do I do? And so no one in the world is going to know better than Heather in terms of what it is that it is. And so I have my own bias and frustrations in this world, but I know, having spoken to Renee, that you are a very level-headed person. So tell me what you think is, what can a patient do that's non-surgical?
So I get a lot of patients that come to me mostly for back pain, and then oftentimes they don't even realize they have DR. So it's often overlooked, first of all. So when they do come and we notice that that's a condition, that's a concern, a lot of times we will try and work on strengthening soft tissue, postural awareness, certain things like that. But we're always digging for the underlying cause. If there's no mechanical back problem and it's purely a muscular problem, and it also depends on the grade, right? And the severity of DR.
Okay, I apologize, and I'm not generally a rude person, but I'm going to keep interrupting you to help guide the conversation. So forgive me. So the first thing is, of course, you described it perfect. So there are different ways that people get to the end point, and how they get there will define some of the questions and things that happen. So obviously in your world, it's not common to people, maybe less common, people say, hi, Heather, I'm here because I have a 7-centimeter DR and blah, blah, blah. It's more like, my back is killing me. I have aching pain. And so they come to you that way. You, being a skilled practitioner, will realize that no, there's nothing going on. You don't have a herniated disc. You have no radiculopathy. But reality is that your core is very unstable due to this condition. What condition? Oh, my muscles are separated. That's called DR. Oh, crap. What is that? Am I going to die? No, you're not. It's just comes from pregnancy. So the question is, how do you define the severity of it? And how do you define for them that they have DR? So if someone's sitting at home is like, well, how do I know I have it?
So the degree of separation, when we contract those abdominal muscles and there's either some protrusion, some herniation there, but really and truly, it's just how many fingers you can kind of put between the two, in that separation.
Right. So what we're going to do is, someone sitting at home is like, oh God, do I have DR? I don't know. Do I? So there's one way to find out is what we refer to as a straight leg raise, which means you lay on your back, you put your hands on your side, and you raise your ankles off of the bed or floor about, I don't know, 3 inches. You do not engage, you don't use your arms to do it. And then you look at your abdomen, and there's this sort of like kind of camel hump thing that can happen if you have severe DR, which means that your insides are literally seeping out between the edge of these muscles. So imagine 2 sliding doors. The sliding doors are slightly widened, and all of a sudden you have this protrusion that you can't see as well when you're standing, but you see significantly when you're contracting your muscles, because your muscles stay very stiff and everything inside that's soft and gushy comes through. So that's one definite thing. And the other that you were referring to, which is quite accurate, is that when you do that same exact maneuver, you can put your fingers down the middle of your abdomen. And when you contract your muscles by doing a straight leg raise, you can feel the edges of the muscle side to side. And that gives you an indication. You really shouldn't, if anyone has children and they go do the same thing on their kids, they're going to see what perfection is supposed to look like. And they really don't have a gap between their abdomen. So that definitely is one of the ways to diagnose it. So go ahead, you diagnose them and they're like, well, this is what the story is. So where do we go from there?
So I see a lot of patients that have had mesh procedures done before, and I see, a lot of these post-surgical type conditions. And a lot of times that doesn't really help these situations because they they really don't address the problem of the actual muscle contraction. So I actually believe that there's not a lot that we can do other than prepare the body and the muscle for reattachment. But so typically we'll do a little bit of soft tissue work. We'll work on a little bit of neuromuscular reeducation and recruitment, and using breathing techniques to kind of engage all the different layers of abdominal muscles, just so there's some awareness of it.
I think you said it perfect. So let me give you, this is a good opportunity for us to have a dialogue, which often doesn't happen, which is between the physical therapist, say the bar instructor, because I consider you guys in a similar arena, and the surgeon. So the reality is that as this muscle is pulling, there are two things that happen. I know that because this is what I do every morning and every day. And I know this because I've looked physically into the abdominal wall, which you guys are so eloquently trying to figure out from the outside in. And so two things happen that lead to this massive bulge and instability of the abdominal core, which then leads to all the symptoms that we discussed in this episode before: digestion issues, back pain, constipation, incontinence, etc. So one of them is the classic muscle separation. There are defined edges to this muscle, and anybody can flip through Google and do an anatomy, and they get pulled apart. Now, unlike a true hernia, which is an actual hole, there is nothing there, and internal contents are coming through. A diastasis is an attritional situation where it doesn't tear open where there's a gaping hole, but the connective tissues are very thin, and as a result are not doing their job and barriering and allowing things to stay back. So they pull, and when you're in the abdomen staring at the muscles, you can see the edges of the muscle, and then you can see this very thin film that has become between them that should have been interlocked. That's diastasis. But in addition to that, depending on so many factors, genetics, how big the children were, how many weeks it went, how crappy your tissue is in general, the surrounding abdominal wall atrophies, and you get a pulling of the obliques, and you get this floppiness that occurs to the abdomen. Okay? And so where I think the huge impact by physical therapy and all other core strengthening individuals comes in is in that section. So you are not going to ever grow those things back together. Anyone who sells you a device or a treatment or a protocol is completely selling you snake oil. I've been doing this for 15 years. No, you don't regenerate your liver. You don't regenerate a missing brain cells after a stroke. You will never grow those muscles together. So what is it that you do with physical therapy and bar and all those things? You are strengthening the residual or surrounding core muscles so that the resting tone is higher and stronger. So they are helping maintain and crutch the crack in the middle of your abdomen. So it's not it's not carrying all the weight. And in individuals who, in addition to have diastasis, have really atrophied or floppy abdominal wall, you guys are crucial, and you make the resting tone tighter and more rigid. And absolutely, there's a place for all of the non-surgical interventions. And in people who have mild to maybe moderate, that's all you need. You maybe not need any surgery. You're not going to go in there to fix a 1 centimeter, 2 centimeter separation. That's insane, because the ramifications is huge. Now, you have extra skin, you have loose skin, all these other things, perhaps. But I certainly, if I see a woman with a completely flat abdomen with the tiniest little bulge, I'm not going to recommend a massive abdominoplasty for that treatment. I'm going to say, go see a physical therapist if you can't do it on your own, and work on your core. So I'm glad that you and I are together on that page in regards to that. Rihanna, what are your thoughts when you see people and they come to you, you are unique in that you actually had diastasis, you had the surgery, and you helped them with the physical therapy part?
Well, I teach classes to postpartum women, and I'll talk to them about diastasis and have them check themselves to make sure that, because if they do have a compromised core, there's certain things that they may not or shouldn't try, maybe too advanced. So definitely talk about it with them, but I tell them all that I've had surgery. So I said, if you have it, it's like, you can strengthen your core, but if you are still not where you want to be in 6 months or a year from now, surgery is an excellent option. So I'm very open about it. Like if anyone ever, actually I had a mother say to me, she saw me doing some ab exercises that when I had DR, I didn't do them because it would cause my core to bulge and it just wasn't, I didn't feel good.
Yeah.
Anyway, she saw me doing that exercise and she's like, how are you doing that? Like, good for you. And I said, well, thank you. But it was actually the reason I can do this now is because I've had surgery and my core is functioning now and it's strong. Like I'm very open about.
Yeah. And I think that's beautiful. And I think I commend you both, because how often what happens is that when you are on the other end, which is your livelihood is contingent on non-surgical approach to things, you kind of see the world, if you're a hammer, you see the world as a nail. I mean, that's just a perspective you see, and you get so committed to that being the way. Now, obviously, you know, Heather, you have a whole world of physical therapy. It doesn't just revolve around DR. So it's not like you know, your livelihood is jeopardized by this. But I think the reality is, you know, there are individuals who sell these huge, like online, I have patients who come to me all the time who are like, oh my God, I tried this for 3 years and I spent thousands of dollars and I used this binder and that, and I'm just so disappointed. And so what has happened? They've wasted 3 years of quality lives. They've spent lots of hard-earned money. And more importantly, they're just dejected and they're just frustrated and disappointed. And so we need people on both ends, surgical to know not to do it and non-surgical to know when to do it. So, you know, there's people who have these classes and they don't even tell the patients that they've had surgery.
Yeah.
And they're touting that like they're doing this like crow position because, and they've had 4 kids and they're in the crow position because it's all the yoga that they do. No, you're able to maintain your core because your core is brought back into its original state. And so I think that you're telling people is really crucial.
And like you're saying, the people that have had surgery, they're selling programs. They're not like they're advertising their program. There might be like a little small snippet if you really look. They'll maybe talk about surgery, but you're assuming that they got to where they are using their exercise program.
100%. It's so misleading. And the thing about it is, forget about the thousands of dollars that people waste. They're so, they feel a sense of failure.
Yes.
Right? I have failed.
Yeah.
And then, as you guys both know, there's a sense of emotional guilt that I'm not good enough. My husband looks at these other women who look amazing, and I am sort of, you know, I can't get it back by just doing diet and exercise. And so they're feeding off of this psychological sort of internal warfare. And so what happens is, whether that be the physical therapist who just kind of continuously asks this person to come back with this feeling that all of a sudden after 800 sessions, they're going to diastasis is going to magically disappear, or the bar instructor who's doing like pretzel yogas who has had surgery before and not telling people. So the dialogue needs to be as it is today. There is absolutely a place for both of those things, especially post-surgery when you're actually mechanically corrected. So why is it that, so let's talk about this for a second, and both of you guys are physically knowledgeable. The problem is, like any structure, let's just open up the inside of your car. Structures are mechanically designed to work when they're in the right position. So if you move the timing belt and stretch it to the wrong place, it doesn't work because it's not in the right location. Your abdominal muscles need to move in and out, forward and back. That's how they work. And when they crack open and turn 30 degrees, 45 degrees, when they work this direction, not this direction. And for those of you who are listening and not watching, they're basically not functioning the way they were designed. And so what's happening is you're getting no seal in the front of your abdomen. And so it doesn't matter if you do 3,444 sit-ups. I have repaired diastasis in some of the fittest people you've ever seen in your life, to the point that you can see their six-pack, but they're separated. And so the minute we bring them back together a midline, you are realigning the misaligned structure. And then all of a sudden they're like flying, because that's all they needed was that correction. And I had a woman that had 7 epidurals, seven in 18 months, skinny, fit, lean, pre-surgery, and hasn't had an epidural in 2 years. She had hundreds of epidurals because of her back pain. Because again, like you said, you have to find the origin. And so a lot of people in the back pain world get lost. And good for you that you recognize that, hey, patient comes in with back pain, could be a disc, could be a radiculopathy, could be a bone spur, but maybe it's your abdominal wall. This is a postpartum woman. She's in her 40s. She's really young to be. Good on you for doing that. So what are the things that, so on the physical therapy side, what are the things that you think people can do? Let's talk about the post-surgical patient. We've agreed that pre-surgery is a little limiting, but post-surgery, now they're fixed and they want to get back into activity. So let's start with Heather. What do you do? What's your program?
So initially, I kind of look at it in three parts. That's how I explain it to my patients. So I look at the soft tissue, the healing, the adhesions that might be there, how the scar is healing, how the scar is moving. And, we got layers. We're talking about, when we talk about soft tissue, we're talking about skin and fascia and muscle and tendons and ligaments and all those kinds of structures. So really, we look at the healing process, and there's been some studies that show that some work on the soft tissue as it's healing can help the fibrils lay down in a more linear pattern, so not so kind of scattered and all over the place. What those adhesions do down the road is they can create abnormal muscle pull. But if we have nicely loose and flexible healing, then we have improved control. So we go with soft tissue first, then we deal with any kind of alignment changes in the body that are affecting structure and movement, and then we give it back strength. And we do the neuromuscular re-education, a lot of times utilizing breathing exercises and so forth, but those are the basic kind of overview.
Okay, I like that. We're going to take a quick break because I'm going to get killed by my producer. She's going to say, "Why didn't you take a break?" And then we're going to come back, and then we're going to ask Rihanna a few questions. And so join us back. This is Plastic Surgery Uncensored, episode 2 of our 4-part episode. Welcome back to Plastic Surgery Uncensored. This is Dr. Roddy Raban. I have 2 amazing guests, and we have an additional guest who's going to join us on the second half of our second episode of our 4-part series on diastasis recti. That was a mouthful. All right. So welcome back with Rihanna, Heather, and now we have Renee from Dallas. Renee is one of my patients who had severe diastasis. So what we've been talking about, and we did a little brief discussion offline, was this whole concept of, okay, so I have DR. I figured it out. We've talked about how to diagnose it. It means that my muscles are separated. And as a result of having DR, now DR has degrees, as we talked about, mild, moderate, and severe. And in the mild to moderate range, you maybe not know it. Maybe you learn to deal with it. Maybe you go to a physical therapist or do strength and you get by. The conversation that we're having is about severe diastasis and the impacts and what do you do about that. And believe me, more people are suffering with severe DR than you think and the ramifications. And so we talked about not only the diagnosis, but we then talked about what are the options in terms of treatment. When you have severe DR, there is very little you can do non-surgical that will actually correct the separation of your muscles. We talked briefly about the exercising that you're doing is strengthening the residual core muscles so that you are not as floppy and unstable, but it's never going to reattach your muscles. Now, what we talked about was this sort of, maybe I can use the word scam, but there's a lot of people that are trying to take advantage of this vulnerable group of people. In the world, there are always people who are vulnerable and those who are trying to take advantage of them. If you're an old person, I guarantee you're getting phone calls every day with someone calling saying, "I need your social security number. The IRS is coming to get you." That's just the way it is. If you're a young child, there's someone who's trying to sell you candy laced with something. So if you're a postpartum woman, you're going to constantly be gravitating towards anything that is showing women who are postpartum looking like you, which looks like you're 2 to 3 months pregnant, that are bam, flat as a board and look amazing. And that person is going to sell you snake oil that suggests that if you just do these 12-step program or pay just 3 installments of, or wear this particular binder, you're going to magically be corrected. I have 2 amazing guests with me today in addition to a third one, who are going to tell you that is just nonsense, and that's just taking advantage of your emotional state. If you have severe diastasis, you can only correct it with surgery. Now, other things are important that we talked about, but not to the extent that you're just going to like do. And we talked about that. What was funny is a lot of these people who are touting these amazing outcomes, they've had surgery themselves. They just don't tell anybody. So, Renee, welcome. Renee, I just gave a quick summary of the stuff that we talked about. What are your thoughts? So Renee, Renee was I like to say she was an Olympic gold medalist in terms of skiing. That's, you know how like my mom tells everybody that I participate in the Olympics. We make fun of it. And then my friends are like, didn't you just do like a sprint triathlon? I was like, yeah, but those are the Olympics. So I always tell everybody that I have a patient who is like Olympic bound. Anyways, she was a competitive ice skater, had amazing body, had 3 kids, right?
Yes.
3 kids. And your diastasis was one of the most severe diastasis. Like you can take a look at your before and after photos and you're like, oh my God, what's going on with her abdomen? It was that severe. And you were wearing two girdles, two binders. It was a whole ordeal. It revolved around your life. You couldn't pick up your kids. You couldn't do anything, no less ice skate. And 8 weeks post-surgery, you were on the ice. 10 years later, ice skating. And so you had done everything, including working with Heather pre and post. So why don't you give us a little impact on your perspective on non-surgical correction of your DR?
Yeah, sure. So I think there's like a natural progression of when you first get diagnosed with, or you first figure out that you have DR. I think in your mind, you naturally go to Dr. Google. And as you do that, you start to pull up all these programs, and there are just hundreds and hundreds of them, as you mentioned earlier. And your first instinct is to, they say they cure it and all of these things. So you're inclined to go check them out. And so I tried almost every program out there. And I think
name it, be specific, because I think it's important, not name a few like blah, 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 Jane Fonda. Like one of them was a workout series. So give me some examples so that people who are at home, when they're looking online, they're like, oh shit, that's the one that lady said. What are they?
I'll tell you the ones that I tried. There's like a mummy tummy, there's the Mutu, there's, various Facebook groups where they're all focusing on DR. If you go on Instagram, you're going to find a bunch of Instagrammers that are going to be speaking about DR and all the different, exercises that you can do. I tried all that. And I think if you're an athlete, you have this mindset that you put your mind on something and you're going to get there. Regardless of how it's going to happen, you're just going to get there. And I think one of the hardest things and the most discouraging things, at least in the initial process, before you come to terms with that, the only way you can really fix it is with surgery, is that you put your mindset that it's going to cure it. And there's all this marketing, as you mentioned, that is leading to that, like, oh, you're going to close your gap. And so it's like very misleading, and it's very deflating, actually.
Yeah, totally
you start to believe, and then when you don't have those results, and if you have a severe case like what I had, it resorts to nothing. And then you kind of start from square one. You have to regroup yourself, pick yourself back up, and realize that, like, okay. And then I came in contact with Heather, who was my absolute savior in just more ways than one. Thank you, Heather. As yourself too. But yeah, so I think that it's important to understand what's out there, and it's important to know how to navigate. It's important really to understand that, like, curing versus functioning are two completely very different things. So I think that's a very important concept to understand. Although you're functioning doesn't mean you're curing. You're just able to kind of mask it with, strengthening other muscles to kind of compensate for what's really going on.
I think you hit it on the head, and we've here's yet another example, and there'll be yet another, and there'll be yet another. And it's just reiterating the exact same concept, which is that this is a true condition, and it doesn't need a Band-Aid, and it needs a real cure. And the real cure is repairing the muscle, just like a torn tendon. just like a torn ligament, just like a broken bone. This is the same thing, and it needs something definitive. I do want to make a little comment about this idea of hernias, umbilical hernias, and just this whole kind of concept, because they're so intertwined and it's very hard to differentiate, and people get really lost and confused in it. So as we had discussed, diastasis is gradual and slow pull and separation of the abdominal muscles. When that occurs, there is not a gaping hole in your abdomen. There is a thinning of this tissue in between, which is connective tissue, that's holding your muscles together. And that tissue is nowhere near as thick nor strong as the muscles that would be abutting each other. So the garage doors are pulling apart, and what's left behind is this filmy little thin tissue. So the intra-abdominal contents start to bulge out. And as we discussed earlier, how to test it, when you do the straight leg raise, you see this humping effect of your abdomen. Check. Almost everyone, dare even say the word everyone, who has severe diastasis will absolutely always have an umbilical hernia. So listen carefully. If you have a severe diastasis, muscles are pulled apart, your belly's bulging out, there is no way on earth that your belly button and the contents around your belly button are going to stay put, because your belly button is literally held in place by the garage doors holding it back. So as the garage doors pull apart, the belly button pushes forward. So everyone who has severe diastasis has a funky, weird looking belly button, more funky than normal. And inside that is a little bit of, so a belly button technically is a hole, right? It's a physical hole in your abdomen. So it's not surprising that as the diastasis gets severe, little pieces of fat will kind of push through. So people love to over-exaggerate the like, oh my God, I have an umbilical hernia, like, oh, and then there's all this chaos that arises. I have to get that fixed. I put in mesh. People with severe diastasis show up. They've already put mesh in. The diastasis is not even close to fixed. You get this piece of plastic in your abdomen, and you look exactly the same, except you've had 2 surgeries and a bunch of scars, and now you're like miserable. It's all intertwined. You have to be very careful as you navigate this. They are synonymous. The only way to fix your umbilical hernia, which is irrelevant, is to fix the diastasis, which is leading to the umbilical hernia. Do not run out and go get your umbilical hernia fixed by a general surgeon, put some mesh in there, and then wonder why the hell that little square of plastic hasn't fixed this massive hole in separation in your abdomen. It not only is going to be a waste of time and money, but now you have all the scar tissue that has to be addressed during your abdominoplasty. So I really want people to hear that clear distinction about belly button hernias and diastasis. They're like evil twin sisters. They're related to each other, and they're while they are separate entities, they are really one and the same. Okay, and I it's very important to know that. I'm sure, Heather, you know what I'm talking about.
Yes, absolutely. And it's not only uncommon in women, men have it too. It's not just women.
Yeah, of course. No, listen, if your abdominal muscles are perfectly together and you're a healthy person, you have a huge bulge coming out of your belly button, you have a legit umbilical hernia, and that should be addressed. And that may or may not need mesh. We're not even talking about that. We're talking about a totally different condition, whereby which the reason you have the hernia is because you have another problem. So you can't fix the hernia without fixing the other major underlying problem. So, I mean, I think these topics are really, really helpful. And I'm going to just keep underscoring this, which is I love the fact that you guys, and the reason why we have you here is you guys are you're the first line of defense, or you're the first people come in contact with. When a woman has back pain and doesn't like the bulge, she's going to go see her physical therapist, or she's going to go to the bar therapy, bar method. And when they're there, they're at the mercy of whoever's there, and whether or not that person gives them great information. Hey, listen, I totally understand what you're going through. I can help you a little bit, but ultimately this is the condition. Or are you going to take advantage of these vulnerable people and have them come to 3,000 more sessions only to find out they look almost essentially the same?
I think it's important to notate for postpartum women that after they, get cleared after their 6th week, I think the best route to do it or to go about it is really just to go straight to your physical therapist and avoid all of these programs. Don't waste your time. Just go straight to the source who's going to actually help you facilitate healing and to get you to the point that you need to be. So I think again, it's like the doctor clears you and then the patient is kind of like, okay, so now what do I do? So I think this is just a really good way to help guide postpartum moms that probably know that they have it DR during pregnancy, and then just immediately go to your physical therapist and have them assess you for DR and have them get you started on trying to get the pelvic floor going and strengthened. And that way you're kind of on a customized path of how to help you navigate and get to the next point of recovery.
Yeah, and I think one of the things that's very important is to the idea, both you and Rihanna are super fit, athletic women. Both of you found that your athleticism, while it may have been useful, didn't prevent you from getting DR. Both of you realized that you couldn't get it back, you couldn't correct it through athleticism.
Right.
And both of you have experienced full recovery of your athleticism once surgically corrected. I mean, if you look at Renee in terms of physicality, core strength, Rihanna, I don't have the pleasure of having taken care of you, but I'm sure it's going to be the same. She looks as good as she ever did pre-pregnancy in terms of not just looking good. Wow, your abdomen looks good, but I'm talking about kicking ass and riding, ice skating and picking up her kids and doing all those things. So that is the ideal model from which to follow. And as far as post-surgery is concerned, you need to engage in whatever it is that you need to engage to get your full result. So what does that mean? If you are a self-motivated athletic person and you feel comfortable navigating your recovery on your own, knock yourself out. Gradually engage, start going to the gym, see what your body tells you and go for it. If you're an average person and you're not familiar with your body and you need the guidance of a bar method coach or a physical therapist like Heather, then by all means seek the guidance of a professional so that you can then maximize the surgical outcome that you now have. That will be really the message.
And the other thing I'd like to just mention is if the painful symptoms that you had from back or any other body part doesn't get resolved, it's not because of the surgery. It's just that the body has the ability to continue to compensate. And so if it's in a pattern of compensating and that hasn't resolved from the surgery itself, those things can be eliminated afterwards by
that's very true. So I have, and I mean, listen, I can only tell you my experience. I've been doing this for 15 years. I've taken care of thousands of patients. You will see an incredibly significant, severe, holy shit, wow improvement of all of your symptoms immediately within 4 to 6 weeks. Anything that's residual indeed may be something else. It may be it takes time. It may be that you need reprogramming. I agree with all that. But there is no question, and I have seen it literally every single time, that if you have severe diastasis, you can even have moderate diastasis, you will be like, oh my God. Yeah, my abdomen still hurts. Like, oh my God. Yeah, I know my scars, but wow. I just feel like my whole belly isn't falling into the ground. And like, I can bend down and I don't feel like I'm going to just like lose my organs. I've heard every variation and iteration from every woman of every possibility of like, oh my, you just don't seem to understand. Like I can drink soda and not feel like my stomach is this. So there's so many experiential, anecdotal descriptions of the power of correcting your core. And so again and again, I will reiterate it because I'm a believer of this through not just because this is what I do. I don't care where you go. Oh, one last thing is when you decide to do severe diastasis correction, your surgeon needs to know what the hell they're doing. Okay. So that makes sense, right? When you're flying in severe weather, your pilot needs to be skilled, right? When you are doing anything that's in an extreme scenario of that scenario, that person needs to be extra capable. And so when you're dealing with severe DR, then that requires you to seek and identify a DR specialist. And by that, I do not mean self-proclaimed specialist. I mean that you need to go online and say like, wow, look at these people. Holy crap, this woman's like, what's going on with her belly? Bam, flat as a board. That means that that person is a DR specialist. Not because they write it all over their website, but you see time and time again, reproducible results of people whose side views look like a bomb went off and they're flat and fit and in shape. Because you can't just go to some guy who's going to do a tummy tuck and throw a couple of sutures in there and call it a day. DR correction requires a skillful reapproximation and correction of the abdominal muscles in a layered, continuous fashion where you're imbricating and pulling the muscles together such that the net effect is a flat abdomen. If you see enough DR, you'll realize that there's nothing the same about two people's DRs. Sometimes the bulge is massive at the top and flat at the bottom. Sometimes the bottom is exploded and the top is flat. Sometimes it looks like a round football. There's so many variations depending on where your kid's head was sticking out of your abdomen. So when you repair it, you cannot just throw a bunch of sutures in and call it a day. This is not about removing loose skin or cutting out some stretch marks. This is about a calculated, methodical, logical, and accurate repair of the muscles. And so I would caution you, you listen to these episodes and you're like, yes, I'm going to run out tomorrow and fix my DR. And then you go down to the local plastic surgeon and you are screwed. So do your homework. Once you have been empowered by these dialogues, by these incredible women, and you realize, well, shit, I need to fix this thing. This is not going to work. Then do the same amount of homework and find an individual who is going to give you the result that you are looking for by knowing what they're doing. And it's not your garden variety plastic surgeon if you have a severe DR. Right, Renee?
Absolutely. You have to do your research.
All right, guys. So, unless there's anything that's burning to discuss, I think this was a super, super amazing segment. I feel lucky that you guys joined me. And I hope that your, whatever it is that you feel was necessary for people to hear was heard. Obviously, if you want to join the DR group, you have to be invited and have to be special. I'm not invited, so I don't know. But
unfortunately,
reach out.
This means you have to be suffering.
Maybe the Canadians will let you in. I don't know. All right, guys. Well, thanks for joining us at another episode of Plastic Surgery Uncensored. This was episode 2 of a four-part series. And I'm excited. Join us for the rest of the series.
Thank you for having us.
Thank you.